I'm a pediatrician and a child psychiatrist with the medical school here in Hawaii. And I'll be talking to you guys today about some research that myself and my research partner Joyce Wong, I think she's here somewhere, that we did a few years ago at the Keilani Medical Center that MOA really supported us during that endeavor. And so you can kind of follow along with the slides today. I have no conflicts of interest to disclose. Okay, so today, hopefully by the end of my presentation, you guys will be able to describe some common psychosocial stressors experienced by children with cancer, describe what is healing touch, describe the outcome of a local study that we did that looked at the use of healing touch in children with cancer, and discuss some future directions in this field. Okay, so kind of how we're going to go through it. We'll briefly look at the background on local pediatric oncology demographics. Then I'll kind of describe a little bit what healing touch is. It's a complementary alternative medicine therapeutic modality. That's what CAM stands for. Then I'll talk about a research study that we did at Keilani Women and Children's. Probably won't have much time to talk about patient and family experiences with healing touch today, but we will talk about future research directions. Okay, so here in Hawaii, at any given time, there's about 50 kids with cancer that are in active treatment. The incidence of pediatric cancer in Hawaii is about 1 to 3 new cases every month. And most children are enrolled in COG clinical trials. That's Children's Oncology Group. That's the nationwide kind of research body that looks at the efficacy of different chemotherapies and radiation therapies for pediatric oncology. Also, go back one slide. It's interesting to note that in Hawaii, our racial and ethnic demographics are different from the mainland United States. You can imagine in the mainland more Caucasian, more Hispanic, more African American. Here in Hawaii, more variety of Asian ethnicities. Okay, so we know that children with cancer are subjected to significant disruptions in their normal development due to the intensive nature of the treatments that they get, both chemotherapy and radiation. We know these kids, they have multiple hospitalizations for the treatments themselves, and then even more hospitalizations after the treatments because their immune systems get kind of knocked down. They're subject to fever, infections, and they have to get admitted again for more medical care. So, in addition to the disruption of their normal routine that all these hospital admissions cause, these children also go through pain, stress, fatigue. And the current standard of care for these things is giving medicines or giving blood products, red cells or platelets. Next slide. So what is pediatric psycho-oncology? So I'm a pediatrician, I'm also a child psychiatrist, so I like looking at both the medical and the emotional well-being of children. Pediatric psycho-oncology is the area of mental health that looks at the psychosocial needs of pediatric cancer patients and their families. The primary goals of pediatric psycho-oncology are to provide support, reduce stress, improve coping, facilitate normal development. To achieve these goals, we use consultations, behavioral interventions, sometimes psychotherapy, sometimes psychological testing, and definitely liaison with the school and the community. Okay, so where does healing touch fit into all of this? So who here has heard of healing touch? Kind of raise your hand. Okay, so most people are familiar with it. It's a complementary, non-invasive therapy that has been effective in reducing pain, stress, anxiety, and fatigue in adult cancer patients who are receiving chemotherapy and radiation therapy. So if you look in the scientific literature, there's lots of articles on the use of healing touch for adults with cancer. What else do we know about healing touch? In addition to reducing all that stress, anxiety, and fatigue, It's also been shown to enhance the function of the immune system itself. So there was a study in 2007 in the Democratic Republic of the Congo where there's a significant amount of patients with sickle cell disease. It was shown that giving healing touch for 90 minutes a day actually reduced the number of sickle crises, reduced the number of infections, and reduced the incidence of hepatosplenomegaly. So it seemed that in addition to just having the psychological effect of reducing stress and pain, it also seemed to have some physiological effects too. Okay. So like I said, there's a lot of experience with healing touch for grown-ups, not so much research looking at healing touch in kids who are going through chemotherapy for cancer. Okay, so what was the purpose of our study? We wanted to change that. So we wanted to look at the feasibility of providing healing touch to children with cancer who are also getting their usual medical care. We wanted to see the effect of healing touch on reducing pain, fatigue, and stress in these children. And when we first started, we had kind of very ambitious goals. We also wanted to look to see if healing touch would have any effect on the use of pain medication, any effect on their red cell count, their white cell count, things like that. Yeah, we were very ambitious. We ended up abandoning that last part, but this was our purpose. Okay, who were the kids that we were looking at? So these were the kids that could be involved in our study. Boys and girls between ages 3 years to 18 years who were receiving treatment for pediatric cancer at Kapiolani Unit Children's. We would do a cognitive screen for kids between age 3 and 6 to see if they could understand what was going on in the study and see if they could accurately articulate their levels of pain, anxiety, stress, and fatigue. What we used was just a simple scale of smiley faces to frowny faces, and the kid would just kind of point to see, tell us how they were feeling. Yeah, it looks like that. It's called the Wong-Baker Faces Pain Rating Scale. It's been validated for use in children. And, you know, the 0 on the left-hand side is they're feeling very happy, they're not hurting, not in pain. And then the 5 all the way on the right-hand side, very frowning and feeling a lot of pain. Yeah. Kind of cute. Okay, who couldn't be in our study? Kids who failed the cognitive screen, kids who didn't speak English or didn't have an English-speaking family member with them, and children who were less than 3 years old or older than 18 years old. What was the methodology of our study? Okay, so it was pretty cool, I thought. So this was a randomized prospective intervention study with a control arm to look at the effectiveness of healing touch on all those parameters I said: stress, pain, fatigue. We had 2 groups. One was the intervention group, which received healing touch. They were called the Sea Turtles. And they were going to receive healing touch 30 minutes once a day for every day that they were either admitted or they came to the hospital for outpatient treatment. The non-treatment group, which was the control group, they were called the Dolphins. They would get, instead of getting healing touch for 30 minutes once a day, they would be engaged in age-appropriate activities such as having a story read to them or playing a game with a non-healing touch volunteer for 30 minutes once a day. So what we were trying to do was to see if any benefits that were achieved with healing touch, was that due to the actually healing touch? Or was that due to just having a warm, compassionate person spend time with them during that time? You know? Because these are the 2 groups that we had. So both the intervention group and the control group would have sessions whenever they were admitted to the hospital, either on the general medical floor or in the intensive care unit, and also whenever they received care in the PAL, that's the Pediatric Ambulatory Unit. That's where kids would sometimes come for outpatient chemotherapy. They would come, get hooked up to their IV, get infused, and then go home later that day. Since this was all occurring at one hospital and there was small physical space, it wasn't a blinded study. We knew who was in which group. And the length of our study was pretty long, 1 year. Okay, so the kind of way it worked was we talked to the families, we got consent from the family, from the parents, assent from the children, and then they were randomized either to the healing touch group or the control group. The children did not have to be healing touch naive in order to be part of the study. And those that were randomized to the story group, they couldn't receive any healing touch for the duration of the study. If they requested it, if their family wanted it, we would have to exclude them from the study. Okay, so it was really cool. We had over 20 healing touch practitioners that volunteered to be available to provide healing touch for the treatment arm. This is where MOA came in. They were very generous and provided a grant to train all of these volunteers in healing touch. So we had a small little army of people that would come and provide healing touch whenever one of these kids was admitted. It was really cool. Prior to the initiation of each session, the child, the parent, and the bedside nurse would give rating scales on pain, anxiety, and fatigue. So we used the Wong-Baker pain scale, we used something called the feeling thermometer. It's very similar to the pain scale, and another assessment called my fatigue meter to look at fatigue. And we did that pre and post. For the story arm, we did the same thing. So the nurse, the parent, the child, we would fill out these measures for pain, fatigue, and anxiety. Then they would play with the kid or read a story to them, and we would do post measures after that. Like I said, at the outset of our study, we were kind of ambitious, and we also wanted to look at these anxiety medications, pain medications, seeing if there was any impact on their white cells, their red cells, platelets. It turned out this was way too much data to look at for the length of study that we had, so we abandoned that part of the study initially. Pretty soon. Okay, so we did this for a year. We had these two groups. What kind of statistics did we do? Just simple descriptive statistics. We did something called the Wilcoxon rank sum test to compare the pre-intervention and post-intervention scores on all of these assessments. And we did it for both study arms, the control and the intervention group. And then we did the Wilcoxon two-sample test to look at any differences between the two groups, between the intervention group and the control group. And this is what we saw. So we approached 15 patients for the study, and 9 consented to be in the study. That was about 60% recruitment rate. There were 3 patient withdrawals during the study period, including 1 child who died. So this chart just kind of looks at the two groups. So on the left side, we have the children who were in the healing touch group, and the control arm, we had children, on the right side, we have children who were in the control arm. So you can see their age was about the same, somewhere around median age of 7 years old. But they were different other than that. For some reason, we had more boys in the healing touch group, and for some reason we had sicker kids in the healing touch group. If you look at the type of cancer that each group had, in the control arm, all of the children had the same type of cancer, acute lymphocytic leukemia, which is the most common type of cancer. In the healing touch group, there was a combination of different types of cancer, 2 with ALL, 2 with AML, acute myeloblastic leukemia, and 2 with other types of malignancies. So the groups weren't exactly the same. And as you can see, the number in the healing touch group was 6, and the number in the control group was 3. Why was that? Well, we randomized, and then as the study was going, 1 child died, and so we had to put another child into the study to even up the numbers, and then more people dropped out. So the numbers don't exactly, it's not quite an even comparison. Next slide. Next slide. Thanks. Okay, so here is some results that we got. So it's kind of a busy scale. So this is just looking at the difference in pain, pre-intervention and post-intervention. So along the bottom, there's the ratings as described by children, ratings as described by parent, and ratings as described by staff. And you can see that the pre-intervention score for the healing touch group, there's a much bigger drop compared to the pre-intervention, post-intervention scores for the control arm. Now, this also kind of reflects that the kids in the Healing Touch group were sicker than the kids in the control group. You can see all of the Healing Touch groups' pain assessments were pretty high, and I think that was a function of their disease. But it did go down more after Healing Touch than after having a story read. Next slide. Okay, and then if we look at the two groups, comparing one to the other, there was a statistically significant difference in the reduction in pain scores as reported by both children and parents, and distress scores as reported by the parents. Next slide. So it was kind of a, I don't know, pretty great study. If you look in the literature, this is one of the first studies looking at Healing Touch used in children with cancer. So we're kind of on the forefront of that. And you can see this is the number of Healing Touch treatments given at Kakealani Medical Center for Women and Children in 2006 until the present. And you can see around the time that we did our study, 2009, that was the most number of treatments that we got. And then after the study stopped, it kind of went down to pre-study levels. But more and more people are becoming aware of Healing Touch, and we're now at the highest number of treatments at the medical center ever. Okay, so what did we learn from our research study? That it's feasible to provide Healing Touch alongside traditional medical treatments to children with cancer. There's likely a positive effect on this patient population. And Healing Touch is easily learned, it's non-pharmacologic, and it can be a source of relief from pain, anxiety, and fatigue in both adults as well as children. We are thinking of doing possibly another study in the same population looking at Healing Touch again. And yeah, so because we had a small sample size, because there was such kind of a big age variety and a variability in diagnoses, we thought it was hard to compare the two groups. So we're thinking about doing a crossover design study which could minimize some of this variability, because then each patient would serve as their own control. We also learned that we should raise the lower age limit for the lower age range to 7 years instead of 3, because it looks like really the little kids, you couldn't really tolerate having another person in the room, you know, bugging them when they were not feeling good. Okay, so this future study would be a randomized prospective clinical trial with crossover design. We would have a shorter time period, about 6 months, and hopefully shoot for between 18 and 30 subjects, so more than what we got our first go-round. And basically the kids would get either 3 months of Healing Touch or treatment as usual, and then after 3 months they would switch and get the opposite. So it kind of looked like that. So we start off at the patients being randomized and either being assigned to the Healing Touch arm, and then after 3 months crossing over, on the other side receiving standard of care, and after 3 months crossing over. We would stick with the previous dose of 1 session of Healing Touch per outpatient visit or inpatient day. And we use the same measures to assess for pain, fatigue, and distress. And then we're sort of figuring out the logistics of implementation at the medical center, but I think it would be exciting to do. So I think that's all I got. Next slide, please. Yeah, so in summary, kids with cancer go through a lot, so do their families. Healing Touch is a non-invasive, complementary, and alternative medicine modality that can help adults with cancer, related pain, fatigue, and distress. We showed that it's feasible to provide Healing Touch to children with cancer, and it looks like there's a positive effect. Maybe not so for the really, really small kids. And we also learned that we need more studies on the use of Healing Touch in the pediatric population. I think that's it. I don't know if we have time for questions, so we should move on. Okay, thanks very much.